So I'm Steve Clark. I'm a U.S. board-certified, fellowship-trained orthopedic spine surgeon practicing here at MaineGeneral. My background is actually tied to Maine in that I am a Maine Maritime graduate, an engineering department up there, and then I spent some time shipping out, and then I went back to school for medicine, and I went to UMass Medical School. And then after that, I went to my orthopedic surgery training at New York Medical College, and then on to University of Maryland, where I did spine training. So my spine practice, I would say, is mostly a degenerative spine. So what that means to people is conditions that arise just by living life, right? You pick up something heavy, you herniate a disc, you have arthritis in your back, spinal stenosis, radiculopathy, which is when a nerve, is irritated and causes pain down into the extremities. Those are the things that I think we are very good at treating here. Some of the things we don't do a lot of here, right, which I think is important to also acknowledge, we don't do a lot of spine trauma here. So usually if someone's had a big accident like that, we try to send them to a larger center where I think they're more safely and appropriately going to be treated. There's a scoliosis practice, which we don't do scoliosis here, so we'll do non-operative scoliosis in children, but if someone needs a big scoliosis operation, we also send them typically in the direction of Boston for that. So my philosophy of care is that patients should get the treatment that they're looking for, right? And I really have said this before. I think that a lot of my job is to teach the patient what they have, what's the problem, right? What exists to try to approach that problem, and then we then walk together through that and figure out, okay, what's the most logical thing to do, right? Because I think a lot of people hear a spine surgeon and they think, oh my gosh, if I get near that person, they're going to cut me open and look at my spine. And that couldn't be further from the truth. I think, if you talk to or look at even at, patients who I see, I think most patients are not getting an operation, right? It's the rare exception that needs and can benefit and is going to go through and need an operation here. And so that's my philosophy, I guess, is to try to help people understand what it is that we're looking at. What's the problem? Where's it coming from? That's really most of it. In spine world, it's all diagnosis, right? If you can figure out where it's coming from, then you can figure out what to do about it. And then the solution is pretty straightforward in terms of the selection of it, right? Because you only have so many choices, right? You can do therapy, you can leave it alone, you can inject it, or you can do an operation, right? So you basically have 4 categories of care. So it's really understanding and getting to that point where everyone feels comfortable with the decision. And then I guess that's my philosophy, is that get everyone to the same decision at the same time, and then we just say, well, that's what we're going to do, right? And then we make sure that we execute on that and make sure it's good, right? And that's sort of how I see philosophy. So I think at MaineGeneral, what we have is that we have a really community-based hospital system, right? Which it's nice to be in that, because what you see is that in other places that I've worked, you see a business side to a hospital system, and it becomes a very dominant part of the entire organization. And I feel here strongly that the hospital system invests in a lot of services for the patients that might not be in their best business interest, but are the needs of the community. There's a big focus on what does the community need? What are people coming in for? What are they looking for? And then how can we approach that, right? Which I really like that. I think that's my favorite thing about the MaineGeneral administration that I've seen, which is that instead of, hey, we have to do this to meet the bottom line or whatever, here we say, well, this is, we're here to serve a community around Augusta, right? And sometimes that community goes far around Augusta, much further than you'd think, like way up to Bangor and over, to New Hampshire. Like it's a big community. But we focus on that, and we try to figure out what people need and what we can deliver for them. And it's not always easy to do that, especially in my world in spine. There's a lot of resource limitation, and that's just part of being in Maine. There just aren't as many providers of each type. I think I'm most proud of establishing a practice here at MaineGeneral that it seems to be very much on the basis of self-referral from previous patients and their friends, right, and family members. So I see lots of repeat names. I hear from, hey, this person sent me to you, and it's somebody I know that I said, hey, we fixed their spine, and now they're sending me their family members, they're sending me their friends, and that's a vote of confidence that people are comfortable with me, and they think I can do a good job for them and for their loved ones, and I think that's something to be proud of. I don't like to brag, but I think that is one that I'll take, which is that people really are noticing that we're trying to do a good thing here, and that we're having pretty good success at doing that, and that they're willing to send people that they consider valuable to me, and so that's it's a nice thing.